Hello, I'm Ed Conway. Welcome to my study, where I've been holed up most of today trying to understand, trying to get my head round the testing numbers the government puts together. Because you might have seen this, the Statistics Authority sent a very harsh letter to Matt Hancock saying this stuff doesn't really make any sense. So I thought I'd try and get to the bottom of it and work out whether it did make any sense. Long story short, not really. But there are some kind of slightly worrying lessons for us there, and it's worth just having a look at the numbers. It matters, by the way, to know how many people have been tested, because without that you can't get a sense of whether there's going to be a second wave, where people are catching this, what to do about it. So this stuff is really important, and what's slightly concerning is we don't really know what's going on in the UK at the moment. Let's just go through some of those numbers. You probably have seen this one before. This shows you total number of tests as Department for Health and Social Care reports it each day. And look, it's up, well, you remember that 100,000 target. Hooray, they've got beyond that target now. Number of tests is routinely above 100,000 each day. Now, that's kind of arbitrary, isn't it? But nonetheless, they're above it. Does that really matter? Well, not really, because what you're talking about here, what is kind of underneath this line in terms of the different bits of testing that make up this total, is very, very different. There's a whole range of different kinds of tests that are included here, some of which are, you might call them gold standard, some of which are not. And let's just kind of break that down. The gold standard bit of it is this. These are what they call pillar one tests. These are tests that happen in hospitals, so those who have the disease in hospitals, health workers as well. This is the testing that we've had from very early on in this epidemic. And what you can see is, look, it's well below that number. And it's been more or less at this kind of level. It actually peaked in kind of early May, and there's been more or less that level ever since. That's pillar one, so one bit of that line that you get from the Health Secretary every day. Then you've got something called pillar two. Now, basically, this is the other tests for key workers, increasingly for all of the rest of us as well. These are the kind of drive-in tests that you can go and do. And as you can see, it's quite a lot. It's about double pillar one. Now, those are all real tests as we see them, but still, you're nowhere near that 100,000 target if you care about such things. And then on top of that, you've got posted tests. So these are tests that are mailed out to people around the country. And look, these blue bits are basically the biggest part of many of these bars. This is what gets you well above the line every day. But here's the catch. We don't actually know how many of these tests have actually been carried out. So those blue bits, a lot of them haven't necessarily been carried out, haven't necessarily been returned to the NHS and other places. And so it's a bit meaningless to include them alongside the gold standard stuff where we do know the answers. You've got another couple of pillars, I'll just run through them quickly. You've got pillar three, that's serology testing, the antibody test, it's come in recently. And pillar four, those are kind of tests that the ONS carries out to try and work out what's going on across the population. It's worth saying though, that, again, there's a difference there. The ONS tests are a research set of tests. They are not a clinical test to try and ensure that you can save someone's life. So you're taking a load of different things and lumping them into one number. Let's add that line. So now we've got to that line. And you don't get a sense of any of that from the Health Secretary every day when he's unveiling this. It's just, look, we're doing more tests than ever before. It's great, but there are big differences in the types of tests that we're talking about. Most of all, though, the biggest problem is we don't know how many people have been tested. That might sound a bit extraordinary, but we don't know how many people are here. And why is that? It's because some of these tests need to be done a number of times. Some of them, as I say, are kind of the tests that are mailed out, they never come back. Some of them, including these black bits here and the white bits there, the kind of more gold standard stuff, some of them you need more than one test per person because you get a lot of false positives, false negatives. So in many of these tests, they have to be carried out more than once, sometimes more than twice as well. And so that number isn't necessarily the number of people who have had these tests. Instead, the number of people is actually a fair bit lower. Actually, the 100,000 is well above here. So we're talking about a bigger, kind of a different scale here, a smaller scale. Now, these are the number of people who have been tested under pillar one. So again, those gold standard things. And up until about a couple of weeks ago, the government every day was saying, no, we're doing much more than that. We're also testing a lot of other people. And here's the total. And each day we would get these numbers saying, look, we are testing routinely kind of 70, 80,000 people a day through the other pillars, those other kinds of tests. But here's the funny thing. About 2 weeks ago, they just suddenly stopped publishing it. They suddenly stopped publishing how many people had been tested. And it now turns out, when you talk to the Department for Health about it, that those numbers are dodgy. that they couldn't rely on those numbers. So they've basically withdrawn them. They're not available on their website at all. I had to kind of trawl through the archives to actually find them. And so as far as the official numbers go, this is all we know. We only know a fraction of how many people who might have been tested. Why does that matter? It matters because this is one of the crucial metrics for whether there's going to be a second spread. It matters for whether the disease is spreading, whether people are catching it in certain places. And it should be said, you know, like every country around the world is having trouble putting this stuff together. But many countries, Belgium, Singapore, Hong Kong, France, you know, are producing a lot of statistics, granular detail about all of this detail, giving you a sense of what's really going on with the disease. Whereas in the UK, we don't even know how many people have actually been tested for COVID-19. You know, weeks, months after this disease actually struck the UK, we're well past the peak. We don't know how many people have been tested. That's pretty important. And it kind of underlines something that I keep coming across, which is that there's a big difference between the data that we're getting kind of every day from the government, the data we're getting from the Department for Health on COVID-19, and the other data that we get every week, a little bit more kind of circumspect data from the ONS and other sources about how many people are dying of this disease. That stuff is really good, and I'll show you a bit of that in a second. But the stuff on testing is pretty dodgy, I'm afraid. Going to that ONS stuff, we get every single week, we get this update on how many excess deaths there have been. So what do we mean by excess deaths? Well, this line here shows you the average number of people who have died in the first kind of few months of this year. This is the average kind of going back to 2015. And excess deaths basically means anything above that line. So this is deaths from all causes, and it's the UK. So I've got the ONS numbers for England and Wales, but I've also got numbers from Scotland and Northern Ireland. And the key thing here is this gap here, really. Deaths from all causes are way above where you would normally expect it to be at this time of year. And if you tot up what you have there in terms of that area, you're talking about 61,895 excess deaths. It's a terrifying number. We're well above 60,000 now. Probably in the end, we may end up peaking at around 65,000. As for what the final toll is, it's very difficult to tell, because it might well be that we have kind of a negative number for excess deaths in the coming weeks. People who might have died anyway, who had died a bit earlier. So trying to get a sense of where we are in comparison with other epidemics, it's a bit difficult, but it does look like this is definitely worse than anything we've seen, you know, touch wood, since the Spanish influenza, worse than the Hong Kong flu of the 1960s, worse than the Asian flu in the 1950s. It looks like at the moment, I should say. But just looking at kind of where those deaths are happening. So these lines here show you excess deaths in various different settings. So you've got home, deaths at home. Anything above the line is above the kind of the norm that you've seen in recent years. Excess deaths in hospitals went higher there. Early peak in hospitals in terms of people dying in hospitals. It's worth saying this is from all causes. And then in care homes, you can see the epicenter of this crisis. And still, there are more excess deaths in care homes now than there are in hospitals. We are still well above that line. So we're still in excess death territory, but gratifyingly, it is coming down towards more normal levels. But final point here, you know, why are we looking frequently at excess deaths rather than at the official COVID-19 statistics, whether it's from the ONS or from elsewhere? It's because there's a slight kind of something slightly unsettling here beneath these numbers. So if we take, though, the care home line I showed you a moment ago, so everything beneath here is excess deaths, and when you tot it up, you're talking about 28,000 excess deaths in care homes. This is for Great Britain, by the way. We annoyingly don't have comparable numbers for Northern Ireland, but we've got them for Scotland, England and Wales. And you can see 28,000 in total, but of that, about half are COVID-19 deaths. That block there is COVID-19 deaths. That still leaves unaccounted for this block here, about 13,700 deaths, just under half of all of the excess deaths in care homes since the start of this epidemic, aren't really properly explained. You know, they're excess deaths, so they're above the average, and yet we don't have a clear explanation as to why they've happened now. It could well be that COVID-19 was kind of undiagnosed, and many of these cases are COVID-19. It could be something else. It could well be that that there are lockdown reasons, people weren't able to go to hospital and so on, but still a lot of mysteries here. But as I say, with the ONS numbers, we do have more detail about what's actually happening, whereas with those numbers from the government about testing, we just don't really have a clue, to be honest with you.